Let me begin this afternoon by thanking our leadership team. Our team is made up of public health officials, emergency management, local law enforcement, area mayors and managers, and I cannot say enough for their leadership and guidance. I want to especially thank Dr. Kim Eagle, County Manager, Gaston County Health Director, Health and Human Services Director, Chris Dobbins, and Chris Peak, CEO of Caramont, for their leadership and around-the-clock attention on addressing the coronavirus issue that we face here in Gaston County. However, I'm optimistic and I'm confident that our team and community partners will speak, and as we speak, it will be in one voice. Today, I'm hereby declaring a state of emergency for Gaston County. A state of emergency allows Gaston County to take advantage of possible state and federal funding and will allow our operation centers and municipalities to operate in a coherent and efficient fashion to address the coronavirus. We are hereby restricting all public gatherings and social gatherings to 50 or more people in Gaston County. At this time, this restriction does not apply to licensed businesses, healthcare facilities, schools, government offices, and daycares. Employers are encouraged to allow employees to work from home, stagger work schedules, and implement in-person workspace arrangements that optimize space among employees. The reason we have chosen to decrease the size of public and social gatherings is based on specific community needs. Based on the information from our healthcare officials and surveying critical public services, a spike in confirmed cases has the potential to put in jeopardy our ability to handle patients, keep essential public services operating efficiently and effectively to address our community needs. We cannot afford to wait and see what happens. That is not responsible leadership. We must be proactive, and when we get through this crisis, and we will, I will be fine looking back and saying we did too much. I refuse to look back and say we did not do enough. I want the public to know this is not a time to panic or hoard supplies. In fact, the vast majority of our citizens should not experience a health issue at all. What I'm encouraging you to do is to stay away from crowds, practice proper hygiene, call before you come to protect the most vulnerable in our community, our senior citizens, those already under doctor's care, those with underlying health issues, and our healthcare workers. To simply put it, love our neighbor as we love ourselves by deciding to inconvenience ourselves for the sake of the most vulnerable in our community. My mother has an immune disorder. Chances are if I catch the coronavirus, it's probably not going to have too much of an effect on me. I'm relatively young, relatively healthy. But if she gets it, it could be very, very detrimental. So I think we have a time in our community to come together and look out for those in our community that could suffer the most. And that's really the message here. Let's take time, be considerate. We don't have to panic. We don't have to buy all the toilet paper up at Walmart. We don't really have to do those things. Avoid crowds, wash your hands, and think about those in our community that would suffer greatly if we have a spike in the coronavirus. As I stand here today with community leaders from across Gaston County, I am reminded of the resiliency of our people. Today has been declared a National Day of Prayer. Let's come together, pray for our leaders, our healthcare workers, first responders, and those on the front lines each and every day. Let's help each other, check in on our neighbors, and we'll come out on the other side of this even stronger, having faced this together as a community. Thank you, and God bless you.
Good afternoon. First off, I'd like to thank the Chairman Philbeck, the Commission, and those municipalities in Gaston County for joining a united front, a united effort as we address the seriousness of the virus. I want you to know that at the state level, my colleagues and I are both providing for needs as well as compiling additional needs as we hear from our professionals to provide for both the physical health and the economic health needs of North Carolinians. Should you have any questions concerning the virus or other economic impacts or health impacts, please feel free to call our office at 919-733-5868. Again, that's 919-733-5868. Thank you very much.
Good afternoon. Chief Joseph RAMEY, Gaston County Police. As you just heard previously from Chairman Philbeck regarding the proclamation on restrictions of crowds of 50 or more, with me today are chiefs from every municipality, the Gaston County Sheriff's Office, Emergency Management, gyms, and the District Attorney, who also supports this restriction. All of them lend their support to the proclamation. We are simply asking that you voluntarily comply with this restriction. The governor's declaration does allow for criminal charges for large crowds. However, your law enforcement leaders are asking you to self-police and not put your family, friends, and neighbors at risk unnecessarily. We understand the right to assemble. If you elect to assemble in large crowds, you're accepting that risk and liability against the advice of healthcare professionals. Thank you for your assistance with these life-saving measures. We also have Chris Peak, CEO of Caramont Health, with us, along with Dr. Todd Davis, Chief Medical Officer of Caramont Health. At this time, Dr. Davis will step forward to speak on their behalf.
Thank you, Chief Ramey. My name's Todd Davis. I'm the Chief Medical Officer of Caramont Health. And I just wanted to give you a little update, what we're doing to prepare for our community and the potential patient impact that the virus could have if it would penetrate our community in the way we are being led to believe, possibly by our federal authorities. Mr. Peak directed our leadership team in January to begin extensive planning. And we did that along collaboratively with our agencies in the community, including our local county Department of Health and Human Services under Mr. Dobbins, Gaston Family Health Services with Mr. Robert Spencer and Dr. Shirley Oclue, our GEMS with Mr. Mark Lamphere. We currently have created a tiered response allowing us to be able to react to the needs of the patient volume we potentially could have. I'm extremely confident our healthcare providers will show the type of professionalism and compassion that you expect from them, and we will do everything we can to make sure that our patients are safe and our staff are safe. Thank you very much.
Good afternoon. I'm John GREENLEE. I'm the Chief District Court Judge for Gaston County. While I am a state official, I work in one of the biggest county buildings in the state, and that is the court system, specifically the district court system. I am also speaking on behalf of our senior resident Superior Court Judge, Jesse Caldwell, and the Superior Court Division. On Friday, Chief Justice Sherry Beasley, after consultation with state judicial court leaders, issued an emergency declaration to apply to all courts in North Carolina to begin tomorrow, Monday, March 16th. The Constitution of the State of North Carolina mandates that courts remain open. So our courts will remain open on a limited basis. The majority of the courts, both district and superior in Gaston County and across the state, will be closed for 30 days, beginning March 16th. Now in Gaston County, the courthouse will be open. I will have 2 courtrooms running and judges available every day during normal hours. There are some things we cannot continue for 30 days. Courtroom 2D will operate normally where you do domestic violence protective orders, 50Bs, 50C, no contact stalking or harassment orders, and where inmates get their bonds reviewed and get their first appearances. Those things cannot be continued, and the Chief Justice was clear on that. So that courtroom will operate normally. I have a second courtroom that will be open, which will handle all other emergency matters and those things for the necessity of the Constitution and due process can be heard. There will be judges available. So the courts will remain open, but on a limited basis. We are dedicated to doing the business of the people of this state, but in a safe manner. That ensures the safety of the citizens and also the safety of the employees, the staff, the people that have to come to work and work. Jury trials are suspended for 30 days. The only exception is that any jury trial currently impaneled, we have one currently going on in Gaston County, those will remain in progress until being finished, hopefully Monday, Tuesday of next week. But then jury trials. The grand jury has been suspended for 30 days. This is unprecedented in the court system in the state of North Carolina, certainly in Gaston County. We will do the best we can to meet the needs of our citizens. The courthouse will remain open. The clerk's office will remain open to accept filings. But we encourage the citizens to be smart and be safe and only come to court if you have to. If you have questions, call the clerk's office. Find out. Now, on behalf of the clerk of court, Larry Brown, he has provided a number to be used if you have questions. That's 704-852-3100. 704-852-3100. I ask all citizens that have cases scheduled in district court over the next 30 days, that's up until April 16th, do not come to the courthouse to find out your court date. Give the clerk's office 10 days. Between the DA's office and the clerk's office, there's going to be a concerted effort next week to get court dates on every case that's scheduled for the next 30 days. That's thousands. It will be done, and notice will be sent out to all people who are supposed to be in court. If you don't get a notice in 10 days, call the clerk's office. They will give you your new court date. If you have a civil case or a domestic case, contact your attorney or contact the clerk's office, and they will give you the procedure on how to get a new court date set. If you have a case in courtroom 2D, a domestic violence protective order, come to court. Besides that, please be safe and be smart and avoid the courthouse unless you have necessary business. Thank you.
Good afternoon. I'm Jeff Booker. I have the pleasure of serving as superintendent of Gaston County Schools. As you're aware, Governor Cooper announced Saturday afternoon that all public schools in the state of North Carolina would be closed March 16th through March 27th. That will have a drastic impact on Gaston County. In anticipation of this announcement, we began meeting several weeks ago. In fact, we had employees working yesterday preparing for the announcement. We have a call scheduled today with the governor's office to get further direction, but we know some things for sure. It is important that we provide our parents and employees with consistent information as it becomes available. We will continue to do our information dissemination the same way we've done during inclement weather. We encourage you to visit our website for any updates. What we know that occurred late last week, we were fortunate. We had a work day on Friday, so we didn't have students. There were numerous spam emails going around the state closing things, saying this didn't happen. Please, our website will be the accurate place for information related to Gaston County Schools. We will have a tab with district news that you can always click on to find the latest. I want our students and parents and employees to know we appreciate the patience and understanding that you have already exhibited for us, and we feel that in this unprecedented time, we will need more patience and understanding. I can tell our teachers that tomorrow will be a teacher work day. We have been given that authority for tomorrow. We will work to further give information out as the week progresses. You need to know there are a lot of people working about this. I want to thank some people that already began helping us in many ways. Many of them are standing with me today. But Dr. Eagle, Mr. Dobbins, Mr. Peak, Dr. Davis, we have been in constant communication, and we will continue to be in constant communication. Our board chair has sat in on numerous calls with the state giving direction. I have another board member with us here today. They are actively involved in this to a point that we are all seeking information. Also know that for our students, we are developing, that was part of the work that was going on yesterday, we are developing packets of information that we can give you so that learning can go on. But let me stress, nothing can replace the value of our highly qualified teachers. We will do the best. We will work to make things available, but recognizing that 65% of our population receives some form of assistance in food. We have already begun a plan that we will activate our summer feeding program on Tuesday. We have selected sites and we'll be doing that. We will start small with that and get that rolling out. But the governor may come out with a different plan, but that is our plan, that we would have that activated on Tuesday and start distributing meals similar to our summer feeding program. We would start with 10 sites. But again, hear me, things are evolving, and as the state empowers and asks us to do things, we will respond. To all of our employees, I appreciate what you have done and what you will do in this time. We will do our best to keep you informed, but it is a time for us to be calm and to take things slowly. We will share the information as it becomes available. But for example, we went home Friday night. I'm a member of the large district consortium, and we had met Friday, and this is where we were and what we thought we had. Yesterday, there were positive tests, and the governor did this. Things will change that fast. So please give us patience as we communicate.
Thank you, excuse me. Thank you, Jeff. My name is Chris Dobbins. I'm currently the director of your Department of Health and Human Services here in Gaston County. I had some prepared remarks today, but hearing the professionals that went before me probably helped me with these words that I don't need to read. You are in exceptionally good hands in Gaston County. The people that have spoke before me today speak as one voice. We're in this together. You may have heard the term social distancing a lot in the previous days. I would like you to think about another term, social caring, because that's where we're going to need this community to go moving forward. We've got the expertise, we've got the resources, we've got the support. Now's an opportunity for us to help each other. Personal health is always something we talk about, but this is about our community's health. And being in front of this current crisis is going to go a long way in not thinking we should have done more in its aftermath. I salute the leadership that you have heard from today, being proactive. We are truly, again, all on the same page, trying to ensure the safety of our citizens. Now is not the time to panic. Now is the time to see, how can I help my neighbor? So I implore each and every one of you to take that message back to your neighborhoods today. Certainly if there are specific details or questions you want to ask about the Health and Human Services Department, we'll be available to answer that. But if I could give you no greater message today, it's about helping each other and taking care of each other. And that's how we'll get through this. Thank you for your time.
Thank you so much for everybody for coming. We'll be starting in on a question and answer portion here in just a minute, but I did want to take the opportunity to have all of the different chiefs of police and members of law enforcement that attended today to please stand and be recognized. This is a great partnership between not only the county, but the municipalities as well. as Chief Ramey pointed out, this is not something where we want to be going and busting up groups of people. Our chiefs of police, our public leaders, we want this to be voluntary compliance. We want people to recognize the seriousness of what we're asking and not to be scared, but to be smart. With that, I'll open it up for questions from the press.
Just want to confirm at this point, no positive tests here in Gaston County, correct?
That's correct. I can bring up Director Dobbins to speak more to that, though.
The term confirmed is becoming a very serious word. And to this date, we do not have a confirmed case. But let me qualify that. Just because we have not gotten the test results back should not give anyone a false sense of we do not have a challenge in front of us or the potential for the virus in our community. So while I will say we do not have a confirmed case that we're aware of, there's a very high probability that we have the virus in our community, and we're responding as such. But good question, thank you.
Following up, are you guys having any issues getting enough tests like other counties are to test the residents here?
Yeah, I think the best way I can answer that is we are working very closely with all outlets to increase our ability to test. At present, we have categories that we are basically triaging and tiering our response to that, i.e. the most serious or highest risk individuals. We are testing them because we certainly have the capability to. We are not quite at the ability to test anybody and everybody who just wants to know if they are or have the virus.
Other questions?
Yeah, I've got one. I'll ask from back here if I could, please. And I don't know who can answer it, the manager, Mr. Torbitt maybe. We mentioned that by going into a state of emergency, there are benefits that we may receive from the state and federal government. Can anybody expand on what those might be so the public may have an idea?
Kevin, would you be willing to take that one? I'm going to bring up our Emergency Management Director, Kevin Gordon.
Good afternoon. Sir, at this time, we would wait to seek guidance from the North Carolina Department of Emergency Management on what those funding streams may be and how they can be utilized. There are some categories that are authorized through what's known as the Stratford Act, but that is an emergency declaration that the President did not declare. It's more weather-based and disaster-based. What he did declare with his emergency declaration of Friday does clear some funding out in specific categories, but as today, it's premature to describe what those funding sources may be, but they will be some likely in the future. But again, it's too early to tell what they may be, and I would advise everyone to wait and let's seek guidance from the North Carolina Emergency Management and the Governor's Office on what we may receive and what we can utilize that for in the future.
Director Dobbins, if I can bring you back up and just reemphasize the hotline number that was set up this week.
Yes, for those individuals who may have questions, concerns, want to know if they should be tested or if they should see their family physician or what to do next, our community hotline is 704-862-5303. Again, that number is 704-862-5303. Currently, that line is open from 8 o'clock till 5 p.m. Monday through Friday. We do anticipate the calls are going to increase, and we are looking at expanding those hours. However, if it is after hours, we do have a routing system that gets you to an individual to still answer your questions. So again, that number, 704-862-5303. Thank you.
Any other questions? Sir.
Say in the event that all the students have to go online, say for kids who don't have online access or laptop computers, what would they do in that event?
That's a great question. Let me bring up Dr. Booker. I know his team has been working on that.
We have been working with the Department of Public Instruction as well as other providers. What we know is that we do not have unlimited internet availability for all of our 31,000 students. So that is part of the purpose of developing learning packets that we will utilize in the interim period while measures are being taken. We know that some of the major providers have talked about providing free access, but that will take time to get into place. So that will be an evolving situation.
Any other questions? If not, we'll be putting out a press release later today to kind of recap everything that you've heard here. We'll continue to monitor the conditions here in Gaston County and keep you up to date as we have any information according to positive testing or any other actions that the board would take. Yes, Larry.
Just to go back to the very beginning, Governor Cooper yesterday talking about banning public and social events of 100 people or more, and now we're in Gaston County talking about 50 or more people in social and public gatherings. What does this mean for stores, restaurants, malls, anything of that nature, bars?
Sure. So I can bring up Chairman Philbeck to talk a little bit about that, but briefly, there is an exemption carved out for businesses to continue to work, as well as for schools. And obviously, we know that the schools have been closed for the next 2 weeks, but we're putting that exemption in case that they need to be used as feeding sites or as other means of gathering students or other individuals. The big focus here is on non-essential gatherings. So things that you don't absolutely need to. We don't want to see the economy grind to a halt. We want people to be able to continue to go to work where it's safe. But we also want our citizens to know that the less person-to-person contact that they have with other folks, the better off that they're going to be. And let me bring up the chairman to kind of reemphasize that point.
Thank you, Adam. In the declaration, businesses are excluded from that. I have heard a concern, well, you know, businesses are still open, but, you know, some of the churches are closing. We're not asking for churches to close. What we're asking for churches to do is maybe bring it down to 50 or more people. Maybe have multiple services throughout the day. Maybe do small groups. I want to make it clear too, for those that know me and know this board, taking direction like this is not easy. And we wanted to do the least restrictive things that we can do. I want to put it bluntly. If we have a small spike in coronavirus cases in Gaston County, a small spike, I'm thinking 10 or 15. I'm not talking about thousands. It could literally put our jail in jeopardy. It could put our hospital in jeopardy, Health and Human Services in jeopardy. We could literally have to decide who gets a respirator and who doesn't. So it's that serious. Not for me or the vast majority of citizens, because we're relatively young and healthy, but it is for the most vulnerable in our community, our senior citizens, those that already have issues, those that are already in the hospital. So what we decided to do is do a restriction to the best that we can to keep the large crowds away from each other. At the same time, try not to influence commerce and panic. So it's really simple. Stay away from large crowds, practice proper hygiene, call before you come. Thank you.
Thank you, Mr. Chairman. And to that point, just want to clarify that we don't want any groups larger than 50. So that's what we're talking about. So if you've got a group that's smaller than 50, that's still permitted under the state of emergency declaration. One more point as I was listening to the chairman speak, just seeing a lot of people this weekend with St. Patrick's Day, being out in the community, especially younger people that are maybe thinking, okay, this isn't going to affect me. And this is what gets to what Director Dobbins talked about with social caring. You may be younger, you may be healthy, this virus may not affect you much, if at all, if you catch it, but you can be a carrier of that virus, and you can spread it without even knowing. And the impact that can have to those that are immunocompromised, that are senior citizens, can be serious, if not fatal. So this is what we're talking about for the members, the citizens of Gaston County. We're asking you to make a short-term sacrifice for the betterment of those that cannot do anything about this, that are at risk because of this virus. Do we have further questions? Okay. Thank you so much for attending. The press release will be going out later this afternoon. I want to thank everybody for coming, and have a safe drive home. Thank you.